name's Megan. I'm going to be a nurse practitioner student from Jefferson College of Health Sciences working with you today. How are you doing today?
I'm doing good. How are you?
I'm doing fine. I'm just going to wash my hands over here.
Okay.
While I wanted to ask your permission today, me being a student, number one, for me to do your assessment, and number two, to film it today. Is that okay with you?
That's fine.
Okay, great. And your name is?
Darren.
Okay, great. Well, what brings you in today?
Just annual physical exam.
Okay, great. So just basically a head to toe, check you out kind of thing.
Correct.
Great. Okay, well, I'm happy to do that today.
Okay.
What we'll do is we're going to start with your cognitive function. I'm just going to ask you a couple of very easy questions.
Okay.
Just meant to do a complete physical on you. So
All right.
if you can tell me what day today is and where you are today, please.
I'm at Roanoke Carilion Memorial Hospital.
Yep.
And today is August 26th,
Great.
2018.
Thank you very much, Mr. Mellon.
You're welcome.
And how are you feeling today? Are you having any pain whatsoever?
Nope.
Not anywhere.
Just an annual checkup.
Okay, great. So you're feeling fine.
Mm-hmm.
Great. Okay, well, I'm going to start the exam with taking a look at your face and your head, look at your skin and your hair, and looking for any abnormalities or spots that we need to take a look at. Looks good so far. I'm feeling for the temperature. I'm going to take a look at your eyebrows and your eyelids and your eyelashes. I'm going to look at the eye itself, the round clear part in the front called the cornea. I'm going to look at the whites of your eyes for any discoloration called the sclera, and the conjunctiva. I'm going to pull these down and see if there's any discoloration to those. All that looks good so far. Don't see any abnormalities there. While I'm here, I'm going to go ahead and look at the outside of your nose and your ears, see if they're all symmetrical. Don't see anything abnormal here, and your neck here. Good. What do you do for work? I can tell you have some sons.
Construction.
Yeah, I can tell. I'm looking at the back of your neck here. I was wanting to ask you if you wear your sunscreen. As
much as I can, yes.
Okay, good. Make sure you wear that every day.
Okay.
Next part of the exam is going to be I'm going to look at your pupils. So I just want you to look straight ahead, and I'm just going to look at how they react to this light. If you can just look straight ahead and bear with me, I'm just going to shine a light in your eye. That one's good, and that one's good. Fabulous. Yep, that's all normal. Next, I'm going to go to the ear exam. What I'll do is just look in the canal of your ear for any wax or any foreign objects. Take a look at how those look. And sorry if I tickle you. Oh yeah, that one looks real good, real clean. Membrane looks great. Oh, that looks great. Okay. Thank you very much.
Okay.
How you doing, Patty? And let's see. Next, I'm going to look in your mouth. I'm going to look at the outside of your mouth, your lips. Say, open your mouth and let me just look inside, please. And when I look at your cranial nerves, 9 and 10, the vagus nerve being 10 and the glossopharyngeal being 9. And how I'm going to check that is you're going to just open your mouth and say, ah. Okay, great. That looks all normal. Okay, you can stop saying ah now. Keep your mouth open. I'm looking at your hard palate and just your mucosa in there. Bite down when we look at your teeth. Looks great. And also I want you to, what I'm going to ask you to stick out your tongue so I can test your hypoglossal nerve, which is cranial nerve number 12. Just stick that straight out for me. Very good. Okay. Wonderful. Okay, mouth looks great. Put this away. Next thing we're going to do is I'm going to look down at your neck for any pulsations. I'm going to check your carotid pulse here. Nice and strong, regular rhythm. That looks good. One at a time so I don't make you pass out. Okay, next thing we're going to do is I'm just going to ask you to drop your gown so I can take a look at your chest and your back. I'm going to watch you breathe, see if you have any retractions or any difficulty breathe. I'm looking at the front and the back, how easy you breathe. I'm going to use the back of my hand to see the temperature of your skin, quality of your skin, turgor. I'm going to pinch it up to see if it comes back to place quickly. It does. Now I'm just going to listen to your breath sounds and your heart. So take a few deep breaths for me, please. Okay. Sounds great. I'm going to get the front of your lungs. Now I'm going to stop at the heart here and listen. We're going to listen for the aortic area, which is the second left midclavicular area. I'm going to listen with my diaphragm and my bell. And I'm going to go over to the pulmonic area here, to the right. The diaphragm and the bell. Sounds good. Move down to the second pulmonic area here. And the bell. Now we move over to the tricuspid area. Sounds good. The bell. And finally to the mitral area over here. Listen to all the different parts of your heart. I'm going to turn over and listen to the bell too. And then I'm going to find on your chest where I can feel your heart the strongest beating. And I think it's right here. It'll be the left. Fourth intercostal left of that there is where your point of maximum intensity is. Okay, so now I'm going to have you lay back on the exam table. I'm just going to look at the contour of your abdomen, see any masses or bulges. I don't see any. Your skin looks good here. Your turgor is good, quick to retract. Next I'm going to listen to your bowel sounds. Then all four quadrants here. And I hear them all. Sounds good. Then I'm just going to palpate all four quadrants here. Very good. Thank you very much. Now you can sit up. We're almost done. I'm just going to take a look at your arms for symmetry, your joints here. I'm going to feel the temperature of your arms and check your trigger. I'm going to check your radial pulses here. And check your cap refill, which is checking on your finger, making sure that white mark disappears within 30 seconds there. Those look great. Now we're going to come down here to your legs and take a look. See, you've got some calluses on your knees. That's from your work?
Yes.
Yeah. Are they in any pain at all?
No.
They just look strong to me. And checking for any swelling in your legs. Anything that makes the imprint of my hand. I'm going to come down here to your feet. And I'm looking for the temperature and turgor of your skin down here. Everything looks real good. I'm going to check your pulses in two different places. One behind your ankle here, and one on the top of your foot. They feel really good. One here, and one here. And as I'm doing that, I'm going to check your cap refill. 3 seconds here, 3 seconds here. Well, Mr. Mellon, we are all done here. You can put your gown back on, and then I'll be back to discuss the results.
All right, thank you.
You're welcome.